My name's Dr. Janet Mgamba. I work with the Ministry of Health, Community Development, Gender, Elderly and Children in the United Republic of Tanzania. And today I'm going to talk about the processes of developing the National Action Plan for Health Security. Most of you will be asking yourselves, why do we really need to develop the plan? We want actions which are directed to area of greatest need, but we also want resources to be allocated appropriately. And then we also want to identify activities which can really be monitored and evaluated according to our goal. So we started our process of National Action Plan for Development of Health Security as we signed the declaration to join the Global Health Security in 2015, and we volunteered ourselves to have the JE, of which we did the JE in 2016. Prior to the JEE, there was a lot of multi-sectoral preparations so that all of us could be aware of the self-evaluation tool and we could have the ownership of the whole process. We completed our JEE in 2016 February, and thereafter in November we started the process of developing the country action plan. The processes of the action plan were very extensive, but they were led by WHO. But we also had other partners and other stakeholders within the ministry, and this actually ensured that there is a One Health approach in the whole process. This for us was actually one of the very big major milestones because it brought partners of which we haven't been sat together for quite some time, but all of that could actually sat together and understand what areas need to be really highlighted. So in March 2017, we did a detailed costing of the action plan, and this actually ensured that some of the areas of which were identified as critical are really budgeted using the same health system approach. So our plan had actually linked with other existing initiatives, but also the broader concept of health system approach. We later launched our plan in September 2017, and this for us was really a very major milestone, and this was attended by several ministries. We also had members of parliament and as well as the media, and the process of launching for us was very critical so that we could really send messages to the community, because this National Action Plan is not only for the government officials at the top level, but it's actually the plan which has to be used from all across all levels. So how many stakeholders were involved, and how did we really involve the stakeholders? This was really an extensive process, and as I've said, the WHO was leading the technical guidance, but we had also partners from the Prime Minister's office where the coordination of all the partners in the plan is going to be formed. But we also had members from the private institutions, we had CSOs, we have FBOs, we also have other key stakeholders within the ministry. And the successful implementation of this plan is actually a joint effort. So how did we really ensure that the plan aligns with the other initiatives? We actually, as a country, we understand that we also had other ongoing initiatives. We had the AMR, we have the PEEP framework, we had the health system approach, and all these approaches were actually used to develop this National Action Plan. So that this plan is not really a duplicate of a plan, but rather than a plan which will be used as a coordinating platform to coordinate all their activities and be really an involving plan. So what are the key benefits of the National Action Plan for Tanzania? I think the first and the foremost is the development of that plan, which for the first time brought together various partners to sit together and understand that this is really health security is the ownership of the whole sector. The plan actually demonstrated that different stakeholders such as police and migration have a very big role in playing for the health security in the country. But also the plan clearly shows that the gaps need to be addressed to achieve the health system of a particular country. So we had a slogan actually in the Maasai, which are in our country, that if you want to walk fast, walk alone. But if you want to walk far, work together. And through this plan, we have actually worked together, and we are very sure that we have actually some lessons learned. So what are the key lessons learned in the development of this National Action Plan? The first one is the development of the comprehensive action plan can only be achieved through a multi-sectoral participation. So not all sectors would really understand a particular sector in terms of initiative, but if you come together, you can really have a comprehensive approach to the health security. The costing aspect was one of the biggest areas of which we found to be challenging, and this requires more expertise. It takes plan and time to develop the plan because of other competing priorities. But it is also very important to understand that there has to be country ownership and country driving the whole of the process. It is important also to develop a monitoring framework to monitor this National Action Plan. And the last one is that the coordination of the action plan has to be put on the highest level of the government to ensure there is accountability and as well as compliance. Thank you.